Stress is the leading factor causing postural collapse and decreased biologic sustainability of human beings. With the majority of patients living in a hyper-stressed state of life within their environment, a global posture pattern has emerged that is contributing to structural and functional human breakdown. In a state of stress, the posture of the body reverts to its most primitive posture, a flexor or adductor dominance. Patients in a hyper-stressed state present with anterior tightness above the T6 spinal level. The shoulders and the neck are forward with internal rotation of the arms. They also present with posterior tightness below the T6 spinal level, including the lumbar paraspinals, the glutes, as well as the hamstrings. External rotation occurs at the hip, causing toe-out foot flare and pronation of the foot. Flexor dominance above T6 causes hypertonic scalings and SCM musculature. SCM hypertonicity leads to first rib elevation and compression of the brachial plexus at the C8, T1 level primarily. Compression of the neural tissue leads to peripheral neuropathies and compression of important vasculature, which leads to conditions such as TOS and Raynaud's syndrome. Anterior rolling of the shoulders with upper back extensor weakness also causes elbow flexion, which stretches the ulnar nerve and causes neuritis, or a hypertonic pronator teres, which can lead to pronator teres syndrome. Associated with flexion may also lead to carpal tunnel syndrome. Stretched and weakened erector spinae below T6 lead to hypotonic multifidi, spinal misalignments, vertebral disc herniations, peripheral neuropathies, psoas flexion, sciatica, and piriformis syndrome. As the pelvis misaligns, the high hip tends to be on the side of cortical dominance, with ipsilateral psoas tightness. Internal rotation of the femur and tibia occurs on the opposite side of the weak cortex, with pronation and gastrocnemius and soleus tightness that can lead to Achilles tendinitis. There's decreased chest expansion, leading to decreased lung expansion by 12 to 15%, with decreased lung capacity, hypoxia, or lack of oxygen for certain tissues. Hypoxia increases the acidity, making the tissues more infectious and decreased afferent input to the brainstem. The cerebellum receives information from the muscles and tendons, the peripheral limbs, and communicates this information to the cortex to stimulate tone. Inhibition of mechanoreceptor flow to the cerebellum will cause a disruption of controlled movement. A continued sympathetic nervous system response leads to anaerobic glycolysis, causing lactic acid and diffuse pain, such as in fibromyalgia or myofascial pain syndrome. Anaerobic glycolysis also leads to inefficient ATP production, associated with chronic fatigue and depression of the immune function. In response to stress, cortisol levels are higher, leading to sugar cravings and eventually obesity and type 2 diabetes if prolonged. Recognizing this global postural distortion pattern allows you, as a posture expert, to know with certainty the holistic effect of postural correction, and that the work that you do is optimizing human performance for your patients. Remember, it's posture by design, not by circumstance.